Welcome to this explainer. Look, if you're joining us today, you're likely interested in a topic that millions of guys think about, but very few talk about openly, and honestly, even fewer approach with actual medical science. Today, we're breaking down the medical truth about penile length, and we're going to look at this through a purely clinical, completely non-judgmental lens. Our goal here, clear, structured understanding. We are going to bypass all the noise, the embarrassment, the crazy internet myths, and focus solely on what human anatomy and physiology actually tell us. So, is it actually possible to increase your size completely for free? It's the multi-million-dollar question, isn't it? Every single year, men waste incredibly large amounts of their hard-earned money on so-called treatments. They're panicking over their size, seeking out quick fixes, and, the frustration out there is incredibly valid, especially when you feel like you aren't getting straight answers and the internet is just flooded with scams. But what if the answer to maximizing your anatomy doesn't require a credit card at all? What if you could achieve real, noticeable results entirely for free? Okay, let's dive right into this. To get to the absolute truth, we're relying on the expertise of Dr. Rina Malek, a board-certified urologist and pelvic surgeon. Right out of the gate, she completely shatters the illusion of the miracle cure. No medication, no herbal supplement, and no cream is going to physically make you bigger. Period. Those products, they are scientifically baseless. So you can save your cash, because the actual methods grounded in real medical science do not come in a bottle. Now, to make sure we cover everything, this explainer is highly structured. Here's our agenda for today. First, the truth about penile length. Second, grooming for visual impact. Third, revealing your hidden length. Fourth, how anxiety causes shrinkage. And finally, the vital role of erections. All right, let's jump into Section 1, grooming for visual impact, or the optical illusion of manscaping. The physics here are actually incredibly simple. As Dr. Malek notes from her own clinical experience, pubic hair can grow incredibly thick and bushy. And for guys with particularly coarse hair, this creates a literal visual barrier. It physically covers up the base of the penis, so you aren't actually smaller, your anatomy is just, hiding behind a curtain of hair. So by taking some really basic grooming steps, like trimming, shaving, or utilizing other safe hair removal methods, you instantly remove that visual barrier. Manscaping creates a highly effective optical illusion. By clearing the base, you immediately expose more of the shaft that was already there. You haven't actually grown, but the visual impact of your length is instantly maximized, and it's completely for free. Moving right along to Section 2, revealing your hidden length, the fupa, and your pelvic anatomy. And this brilliantly illustrates the reality of the male body. Most people think of the penis as just what's visible on the outside, right? But it's actually a lot more like an iceberg. The anatomical structure of the erectile tissue extends deeply into the pelvis, anchoring way back behind the pubic bone and running right into the perineal area. Basically, a massive portion of your anatomy naturally lives hidden inside your body. Which brings us to a very, very common scenario. Many men notice that over the years, their penis appears to have shrunk. But often, it hasn't shrunk at all. Instead, the guy has gained 20, 30, or 40 pounds. When you gain that kind of weight, you build up a suprapubic fat pad, often colloquially called a fupa, right above the pubic area. This fat pad literally engulfs and buries the base of your penis, just swallowing up your visible length. Dr. Malek actually offers a super practical, entirely free way to prove this to yourself. The next time you're looking in the mirror, physically push back that suprapubic fat pad. When you compress that fat against your pubic bone, you will immediately see the hidden erectile tissue that was buried beneath it. So losing weight, while obviously not always easy, is a guaranteed, medically proven way to reveal length you already possess, but have just hidden beneath excess weight. All right, Section 3, how anxiety causes shrinkage, or the adrenaline effect. This brain-body connection is just absolutely fascinating. The smooth muscles inside the penis operate under what we call adrenaline control. When you're relaxed, those smooth muscles maintain normal tone, and you have your regular resting length. But when you are stressed out or anxious, your adrenaline spikes, and that high adrenaline literally commands those smooth muscles to squeeze and contract. So no, it is literally not just in your head. It is a profound physical response. Dr. Malek notes that patients with severe anxiety often report that their penis seems to temporarily shrink right up into their body. It's a massive contraction of those adrenaline-controlled muscles. But hey, the good news? Working to reduce daily anxiety and manage your stress levels will naturally relax those smooth muscles over time, effectively increasing your resting length right back to its normal state. So, the crucial point is coming up here in Section 4, the vital role of erections and preventing tissue fibrosis. If you struggle with erectile dysfunction and stop having erections, an incredibly dangerous physical chain reaction kicks off. Step 1, the erections stop. Step 2, without that regular blood flow, the tissues suffer from chronically low oxygen levels. Step 3, starved of oxygen, the tissues begin losing their natural elasticity. Step 4, this leads to fibrosis, which is the formation of a literal scar tissue inside the penis. And finally, step 5, that scar tissue causes permanent physical shortening of the anatomy. And this is exactly why nighttime erections and what's commonly called morning wood, clinically known as nocturnal penile tumescence, are so incredibly critical. They aren't just physiological quirks. They are your body's mandatory built-in maintenance system. Those spontaneous erections are literal oxygen delivery systems, flooding the erectile tissue with the fresh, oxygen-rich blood it desperately needs to stay healthy, elastic, and entirely free of scar tissue. To really grasp how serious this fibrosis cascade is, we have to look at the clinical data. Dr. Malik points out that while we don't have perfect data on guys with standard erectile dysfunction, we do have very clear data for men who undergo radical prostatectomies. Often, these procedures result in nerve loss, which leads to the sudden onset of impotence. When we track these patients over a timeline of just 14 months from that onset of impotence, the structural changes are honestly shocking. Over those 14 months without erections, those men lose anywhere from 0.5 to a staggering 5 centimeters of penile length. Let that sink in. That is permanent physical length lost, simply because the tissue was starved of oxygen and developed fibrosis. This absolutely proves that blood flow and regular erections are completely non-negotiable for maintaining your size. Let's move to our summary and see how this all builds into a real game plan. First, ditch the scam pills and creams. They are useless. Second, manage the outside by trimming hair to maximize your visual length. Third, reveal what's already hidden by losing excess weight. Fourth, manage your daily stress to keep adrenaline from shrinking your smooth muscles. And absolutely most importantly, if you are struggling to get erections, do not suffer in silence. Make an appointment with a urologist immediately so you can protect your tissue from permanent oxygen deprivation. Which leaves us with this final, really important thought. It's so easy to view this whole topic purely through the lens of aesthetics or insecurity. But the medical reality is entirely different. Your anatomy is deeply physically tied to your weight, your mental health, your nervous system, and your cardiovascular blood flow. So I leave you with this question. Are you treating your penile health as a vital, integrated part of your overall physical wellness? Take care of your whole body, manage your health properly, and your anatomy will reflect that care. Thank you so much for joining me for this explainer. Keep learning, and I'll catch you next time.